It has become a custom for our people to upload hundreds of videos whenever an actor dies about somebody's illness and the drugs he was taking, etc. We are not supposed to reveal all those things without his permission, but he is no more. And why this video? In one of the videos, one of the doctors said that the reason for a death of a particular actor was early morning walking. And he has said going for a morning walk is equivalent to a suicide. This is what he has said in one of his videos. And also, they said heart attacks are common or more on Mondays. No one can predict death. After all, even if you take all the reports, blood tests, ECGs, X-rays, echoes, everything, the reports may be normal. The doctor can say only your reports are normal. I don't know whether you are normal or not. This is a fact actually. Every time when they go for a walk in the early morning, then these words come to their mind. Does everyone who goes for a walk get this attack? Well, there is a basis on which this statement was given because studies reveal that 20 to 40% of heart attacks they occur in the morning. Why? Especially when he goes for a walking. How this morning walking triggers an attack. Not everyone gets this problem, but who are prone for getting a heart attack, maybe this morning walking triggers it. These people are called at risk people. Why at risk? Because they have some risk factors. That means if you have these factors with you, the possibility of getting a heart attack is more. What are they? Age, family history, weight, high blood pressure, diabetes, cholesterol, stress, smoking. If a person has these factors, which we call as risk factors, the possibility of getting heart attack is more. This is for everyone. Now, all these factors contribute a percentage for getting a heart attack. Now, think about yourself. What are all the factors you have? So, what is the relationship between these risk factors? Number one is your heart rate. Second, blood pressure. When your heart rate increases, naturally your blood pressure also increases. Stress hormones, they also increase when you get up early in the morning. Next is the possibility of blood clotting increases. An interaction of these factors, it may cause heart attack. These interaction are more when you walk in the morning. When you get up in the morning, our body's demand increases. The heart has to pump more blood to all the organs. At the same time, the heart also should receive enough blood supply. So all these things, heart rate increase, blood pressure increase, your blood sugar increases, and the stress hormones level increases. All these things happen. Everybody gets this. But when you have risk factors, these things precipitate an attack. Now let us discuss why the possibility of getting a vascular or blood vessel block, the thrombus, the clot, is more in the morning, and that too when you walk. The first point is stress hormones. When I say stress, it is not just discussing a serious matter and you get stressed, not like that. Getting up from a bed, preparing yourselves for the start of the day itself is a stress for the body. You sleep for 6 to 7 hours. Suddenly the alarm rings. We wake up and we feel the rush hour, the anxiety, the nervousness, whether I can reach there in time. This is a stress. There are many hormones which are released inside your body to face the stress. One is cortisol, then adrenaline, and the third one is noradrenaline. Why these hormones are secreted? We need energy. We have to start a new day. That is why when you see some of the diabetics, your fasting blood sugar will be high. That is because the body needs more energy. For energy, they need more glucose. This glucose, the sugar, should be pumped to every organ, and this pumping is done by the heart. Now, the heart has to do more work. To do that more work, you have these hormones, adrenaline and noradrenaline, and cortisol. To face the problem, it is something like a coordinator. This also increases the blood sugar level, and it also helps this adrenaline to work. For this adaptation, you need a cortisol. These hormones increase the heart rate, increase the force of contraction. The amount of blood which is pumped out is increased by these hormones. Naturally, the heart struggles, especially if it has got a narrowed blood vessel which is supplying the heart, the coronary blood vessels. It should have the elasticity. If that is not there, the heart will definitely suffer. Next is blood pressure. When the heart rate increases, when the stress hormones, adrenaline and all increases the heart rate, when more blood comes out of the heart, definitely the blood pressure rises. But when you have the risk factors like already having a high blood pressure, and if you have cholesterol deposits in the coronary vessels, and if the blood vessels are stiff, the elasticity is lost, then this demand for more work will not be met with. When you sleep, your blood pressure is very low. So, two major factors determine the blood pressure. One is the heart rate, another is the volume of blood which is coming out. The heart rate of a person is around 70 to 80. When you sleep, it may even be less. It will be less actually, 50 to 60. But when you suddenly get up, the heart rate suddenly increases because of the stress hormones and because of the anxiety, etc. Now imagine a person who is already who is having high blood pressure. He gets up in the early morning, an empty stomach, he wants to go for a walk. So he will not take the usual blood pressure tablets. Naturally, his blood pressure is going to rise because of the stress. Second thing, he has not taken the tablet. Third, he is going to walk. All these factors definitely will increase his blood pressure to the extent of causing an attack. But how it happens? It's because of one factor which is called a plaque. A plaque is nothing but deposits of cholesterol particles inside the artery. And this deposits slowly narrows the blood vessels. These plaques will have a thin, the top coating of this plaque is very thin. Your heart rate increases, the force of contraction increases, and the blood rushes into this narrowed blood vessel. This will rupture that plaque. The body thinks that something an injury. So immediately the body thinks there may be a bleeding at the site of injury. So I have to go and seal that injury. Now the clotting mechanism starts. At that place where the plaque ruptures, a small clot starts forming because of the platelets which come there and stick to that place to seal that ruptured area, thinking it is an injury. If you talk about the heart rate, I said normally it is 70 to 80, and during sleep it is around 50 to 60, but when you start working, it may double. It all depends upon what is called the resting heart rate. If the resting heart rate itself is more, now when you do a walking, it is going to double from 70 to 100, 110 and all. Especially a person who is sedentary, who is not doing a routine exercise, now it becomes more stressed because his resting heart rate itself is high. When this is increased, definitely the blood pressure will increase. Another mechanism by which you may get heart attack is concerned with blood clotting. Normally, small blood clots are naturally they form from time to time, and the body has got a mechanism by which it will dissolve these tiny clots. But two things happen. One, the tendency to form a clot, the stickiness of the platelets which initiate clotting is more during morning time. The second thing I told, tiny clots are dissolved, that tendency is reduced. Now, clot forming tendency is high and dissolving tendency is less. Though this definitely makes the possibility of getting a clot early morning, because the platelets which initiate the clotting mechanism, they are very active in the morning. Some of the proteins which help in the clotting mechanism, they are also more active. So platelets initiate and these proteins complete that clot formation. If a small clot is formed, that sticks to that place. Now that obstructs the free flow, and when there is an obstruction or a slowing of blood flow, that itself may increase the size of the clot. All these factors definitely will precipitate an attack. The walking triggers all these factors and you get an attack when you walk, especially for people who are sedentary, who are emotionally disturbed, who are anxious, who are stressed and constantly rushing, waking up with a stressful mind without a, a deep sleep in the night. This possibility is more. And early morning, the temperature is very cold. The cool atmosphere will make the blood vessels to constrict. The same thing happens inside also. The coronary arteries also may shrink. Now, you know the mechanism and the factors which increases the possibility of getting an heart attack. People who are having some of the factors I mentioned, they have more chance of getting this attack when they go for a walk. And remember one thing, many of us have many of the risk factors I mentioned. So when you compare that, that is why they said 20 to 40% heart attack occurs during early morning, especially during walking. And another important thing is warm up. Athlete, if you're an athlete, if you're going for a sports event, you do a warm up. The purpose of warming up is you have to give load to the heart slowly. So you just jump, you just walk, and you breathe. All these things you do. Heart will not be suddenly given extra work. You cannot increase your heart rate suddenly. So you have to do a warm up even before you start a workout. To do a warm up, what can you do? Simple. You do a breathing exercise. You bring your heart and lung to your control. So now, when you go out for a walk, you don't stress your heart. Now you have trained already by doing a warm up. So the heart will not be loaded suddenly. If the heart is already damaged, imagine get up early in the morning and suddenly going out without any more wake up, without taking tablet. Don't you think that you are going to get an attack if you give a sudden workload? It is just whipping a tired horse and getting the work done. And one more thing is the heart pumps about 5 liters of blood, 5,000 milliliters in each every minute. Major portion goes to the liver and kidney. For example, the liver gets around 1400 ml in this 5000 ml and 1000 ml to the kidney, and the brain gets only 600 to 700 ml in this per minute. But the heart, which pumps all this blood to all the organs, the heart receives only 200 to 250 ml of blood to pump this 5000 ml of blood to all the organs. When your heart rate increases, it may require from 200, sometimes it may even to 400. The heart should receive this blood effortlessly. So when somebody says that Going for a walk in the morning is equal to suicide. Remember, it's not for all. I told all the risk factors. People who are already having these risk factors, they are at risk of getting an attack if they go for a walk. But it's just oversimplified actually. Not everyone gets this. If you follow all this, the steps slowly, you can make your heart work more without much struggle. Now you understand the underlying reasons why they say so. And why on Mondays? After all, Sunday is a holiday. Your mind is free, no target. You just relax, you sleep, and nobody watches you. So you are relaxed. And when you go to bed thinking that tomorrow is Monday, you have to get up early in the morning, that night itself causes a stress in your body and you don't get a good sleep. And every time you look at the alarm, whether it's time and all. So naturally, when you get up in the morning early, after a 24 hours rest, when you get up on Monday, you get more stressed on Monday. I think this video has given some of the reasons, some of the explanations for the claim, for the statement that walking in the early morning is equivalent to suicide. It's not like that. And I told you this is heart attack and not cardiac arrest. And the differences between these two we'll discuss in the next video. I'm Dr. Balasubramanian. Thank you.